Hi, it's Kristen here at UT Southwestern. Thank you so much for joining our live chat with Dr. Joseph Trombello from the Center for Depression Research and Clinical Care here at UT Southwestern. We're going to be talking about holiday blues, seasonal affective disorder, and some of the other kind of common conditions that impact a lot of people around the holidays. Definitely, before we get started, I want to say thank you to the North Texas chapter of the National Alliance on Mental Illness, or NAMI. They've been really helpful in promoting this chat and getting out to their followers, and this is obviously a topic that's very important to their members and their friends, so we want to thank them for the support. We're going to be sharing information on support groups and other programs that are available via NAMI throughout the chat, so keep following that comment stream for some information. And as usual, don't forget to like and share. We're going to take as many questions as we can get to, and we're excited to go for this topic. So, Dr. Trombello, thank you for joining us.
Thank you.
So I think this should be good. I do, just kind of to get us started, I'm wondering, how is the seasonal affective disorder and the holiday blues, why do they happen around this time of year?
Right. You know, great question, and there's multiple reasons for it. I think one of the reasons that comes to mind is more psychological. In our culture, and in many cultures, we're taught to believe that the holidays are a fantastic time, right? To quote the song, it's the most wonderful time of the year. And kids are out of school, and you can have, you know, peppermint lattes, and you can watch a month worth of, you know, sort of Hallmark movie channel movies, and it's supposed to be a lot of fun. But with that can come other sort of issues that can come up. Yeah, it's great when your kids are off school for them, but maybe hard for you as a single parent or as a working parent or parents broadly. You have to find childcare or keep them, you know, sort of having fun. And I think that gap between what it's supposed to look like culturally and what it actually looks like for people, particularly people who don't have a big family or feel sort of isolated from other people in their lives. So that's a psychological factor. I think there are a number of sort of biological factors.
Okay.
So it has to do in part with how our bodies make and regulate some neurochemicals, primarily serotonin, as well as melatonin too, and also has to do with where folks geographically actually live. So folks who are living farther from the equator are at much larger risk of that happening.
Okay, so would that be because, you know, those of us maybe who live in Alaska or who live in Upper Maine, they just don't have as much sunshine?
It's a sunlight, and it's also a melatonin and sort of neurochemical component as well.
Okay, good to know. So how is it different from depression, or is it part of that?
Yeah, that's a great question. So seasonal affective disorder is actually nearly identical. The symptoms look slightly differently in terms of you tend to have more of the what we call vegetative symptoms. So really low energy, feeling very fatigued, sleeping quite a lot, as well as having quite an increase in appetite and wanting to eat more. So it tends to be a little bit more of those sort of vegetative or what we may call the atypical symptoms. But really, seasonal affective disorder and major depressive disorder, in both cases, you need 5 or more of 9 symptoms most of the day, nearly every day for a 2-week period, with at least one of the hallmark symptoms: low mood, sadness, in kids being a little bit grouchy or sort of irritable, and then lacking interest or lacking pleasure in things that you used to enjoy doing.
Okay, good to know. So we've got a question in here from Cece, and that is, who's most at risk for developing seasonal affective disorder?
Yeah, so I mentioned some of the variables earlier, sort of geographically, but definitely women are at much higher risk. Overall, women are twice as likely to have major depressive disorder as men, but when it comes to seasonal affective disorder, it's about 4 in 5, so about sort of 80%. And again, I think partially because of some of those biological neurotransmitter, neurochemical kinds of factors that I talked about earlier. Folks with a family history are more likely to develop seasonal affective disorder, as well as folks themselves who have had bipolar disorder or major depressive disorder are also more likely.
Okay, it is seasonal affective. You mentioned that women are more prone to that. Is it the same for kind of what we call the holiday blues?
Right, so I don't know great numbers on holiday blues just because that's a little bit hard to sort of characterize. is
Right.
what exactly we mean. That's not imminently diagnosable. I would say holiday blues are just more maybe a sub sort of threshold level. So you're
Right.
feeling sad, you're lacking interest, you're lacking energy, and it tends to happen around the holidays, but it doesn't, you don't get as many of those symptoms, the 5 of the 9 symptoms.
Okay.
And I should have said this earlier, I'm sorry, also as the name might, as the name sort of says, needs to really be the case that this is happening periodically, seasonally, at typically the same time of year, and then you're not having these symptoms the other 9 months. And so most of the time this tends to happen in the late fall, early winter months, November, December, January, but some people can experience some seasonal factors around the summer as well. But as the name sort of says, it needs to be patterned on a particular time of the year, happening for at least 2 years, same time of the year, and then you aren't seeing these symptoms the other 9 months.
Okay, good to know. So here's a question from Amy, and that is, are there any dietary considerations for fighting SAD? You mentioned that people generally want to eat more.
Right. When you have SAD, you really tend to crave those carbohydrates, and that's kind of one of the other hallmark symptoms. I'm going to be really boring and just say the things that most of us know in terms of fruits and vegetables, and you want to get enough of vitamins, particularly vitamin D. That's not so much a dietary thing as it is a sunlight outside kind of a thing, but just keeping to a healthy, balanced diet. As we know, when you're eating lots of sugars and lots of sweets and lots of carbohydrates, that can really mess with your sense of, well, on the one hand, can mess with how you sort of feel about yourself. If you feel bad about yourself or sort of negative on yourself afterwards, one component, but also we know that you get the rush and then you get the crash, and there can be some real implications for mood as well as for just how we feel day to day, sort of energy wise. So fruits and vegetables and whole grains and those kinds of things that we all know, but then can be hard to work into our diet, especially when, boy, we really want to eat that nice bowl of pasta.
Yeah, we do.
Italian, so I can say that for sure.
All right, good question, Amy. Here's one from Maura. What recommendations do you have for people with MDDs, a major depressive disorder, who are struggling more during the winter months?
Yeah, I think it's a great question. I think figuring out, mainly during that time, what do you need to help yourself feel better? What can you do to get out of this rut that you're in? Maybe you need to seek support from family or friends, a support group, counseling. Maybe you just really need to build in these things you like to do, these pleasurable activities that give you a sense of meaning or purpose in your life, as well as that give you a little bit of fun. So when I work with patients all the time, I would never want to tell somebody what they should do to help themselves. It's better they know themselves and what works for them way better than I do, but we can work and really figure out what's going to help you. I also do a lot of what we call, basically, you do the opposite of what it is that you're feeling. When you're most feeling like you need to lie down and take a nap for a few hours, that may be the time you need to get up and do something a little bit active the most.
Gotcha.
Go for a walk around the block, call your good friend, sort of write them a letter. We often do things that unfortunately maintain the negative way that we're feeling. So it can require a little bit of a mind shift and a little bit of a push, but do the opposite of what it is that you're feeling.
Interesting. All right, great question. Thanks for asking. Here's another one. These are great questions. Definitely keep them coming in. Here's one from Carter. At what point should someone seek professional help when they're feeling the holiday blues or may have seasonal affective?
Yeah, that's a great question. It's also a little bit of a hard line, and sometimes because people are going to know, again, what works for them, but in some ways. But I think if you've been in this rut for quite some time, it's beyond a week or two, it's lasting 3-4 weeks, maybe even longer than that. If you notice that there's been a real pattern of this, if you notice that the way you're feeling is really impacting critical or important areas of your life, I'm not able to connect with my friends and family the way I'd like to, I'm not able to go to work, or I'm at work but I'm not doing such a good job there. So I think when you really start to see that functional impact and you've done a few things but nothing that you've thought of is really helping you to get better. I think also if you're having thoughts about yourself and your own safety and worried about sort of safety risk kinds of concerns, sort of suicide kinds of concerns, that may be sort of another red flag. That, oh, it may be good to talk to somebody else about this.
Mm-hmm.
I've tried a few things and just not quite able to get out of this rut that I'm feeling.
Okay, really good question. Thanks for asking. So are there, so you mentioned earlier there could be some biological causes, but the next
Sure.
question is, what are those? What are the causes of seasonal affective disorder?
Yeah, so really it has to do with our body's production of serotonin as well as melatonin. And those are some core features, and part of where you live and the kind of person you are impacts some of that.
Mm-hmm.
In terms of treatments, there's 3 or 4 well-recommended treatments. One of them is something called a light box, and you can buy them lots of places. You need about 10,000 lux, I believe that's the metric. You need about 10,000 lux worth of light, typically 20 to 60 minutes. And typically you want to do that first thing or sort of early on in the day, every day.
Mm-hmm.
You sit in front of this light box, and that helps your body sort of get more and less of the things that you need to get more of that sunlight, which can help with some of those neurotransmitters and chemicals. So that could be one component.
So are there certain, and I just want to clarify with the light box,
Yeah.
because I have seen them everywhere,
Yeah.
are there certain things people need to look for?
You need to look for the ones with the 10,000 lux.
Okay.
Mhm.
Okay,
And
so brand, it does, not a
brand,
specific.
not brand per se, just it has to do with the intensity of the light.
Mhm. Okay.
Yeah, so that's a great question. Other treatments are psychotherapy, primarily cognitive behavioral therapy, talking to you, some of what we've already been talking about. How do we help you get motivated and engage in these actions that are going to help you to feel better? How do we help you reshame how you think about yourself? If you're thinking about yourself in a particularly negative way, I'm useless, I'm worthless, I'm no good, nobody wants to be near me, those kinds of things, as you might imagine, don't feel so good about oneself, but don't make it very likely that you're going to go out and seek those kinds of things that are going to help you to feel better. So psychotherapy to help you get out and do more things with people or with yourself that help you to feel better about yourself, as well as medication, particularly SSRIs that engage in the serotonin system can be very helpful as
Okay.
well.
And those are generally antidepressants?
Yes, exactly. Yes, I'm sorry.
Okay.
Exactly right.
Okay,
Yes.
so we've got
Antidepressant medications.
Good to know. So here's another question. This one's another one from Maura that she asks, is exercise an effective way to help with SAD? If so, what types?
Mm-hmm. Great question. Absolutely. A lot of research, not just with SAD, but in terms of MDD more broadly. Our group has done a number of exercise-based research, as have many groups outside. Most of the evidence seemed to be around cardiovascular exercise. So, but it doesn't have to be like, running a marathon. It's, moderate, brisk walking, something like 5 times a week for half an hour or 3 times a week for a bit longer. Typically, we say about 150 minutes, so 2.5 hours per week of at least moderate exercise. And if you're doing exercise that's more sort of harder, then you need less of that, maybe 90 minutes of the very sort of intense, vigorous exercise. And that may be more like where you're, sort of running or jogging comes into play. Most of the research has been with that, but we are seeing some work in terms of push-ups and sit-ups and, sort of lifting weights.
CrossFit type.
Strength-based kinds of things, CrossFit, and a little bit of sort of yoga, flexibility, stretching exercises. I think with yoga can often come a mindfulness, meditation, deep thinking kinds of work that folks find very helpful. Breathing exercises can be a core feature of a lot of yoga and mindfulness, and folks can get a lot of sort of assets from that, benefits from that.
Well, so I was wondering about that because obviously with yoga, it's very mindful, but if you're already kind of stressed out,
Right.
is that really
Well,
what you should do?
It's a great question. It's a good point. Yes. The hope is that with mindfulness exercises, by definition, you want to be really focusing on what it is that you're doing at the present moment. I'm really aware of the lights in the room, the sound of my voice, the way my back is, sort of on the chair. It's really present moment focused. And we all have thoughts that come to mind from time to time, have to do this, shouldn't be doing this, that kind of thing. And that's part of the exercises, and you just gently notice that that's happening, and then you help yourself redirect back to what it is that you're actually doing. You're right, though, we don't want to get into what we call a very sort of ruminative process where we're using the whole 2, 5, 10 minutes to focus on how bad we feel and how negative things are in our life. That's not going to be very helpful.
Right, okay. So what about, let's say, you have a family member that maybe the family member seems to be acting differently. You think maybe they've been diagnosed, maybe they have not. What are some ways that you can help family and friends?
Yeah, I think, once again, you're going to know how to best help your family member. You've been in that, or friend, you've been knowing them for months or years. You're going to know what works for them and what, sort of doesn't work. So keep that in mind. Are they the kind of person you really need to shake and say, listen up here? Maybe, maybe not. So you're going to know, I think, something about how to help that person. And each person you interact with may need something slightly differently. But generally, overall, we tend to kind of promote making the use of an I comment. So I'm noticing that you're feeling a little bit off, and I care about you, and I love you, and I'm worried about you. I wondered if you've ever thought about talking to somebody else about how you're feeling, or how can I help you? I'm here for you. I think just really validating and holding folks where they are, noticing the way that they're feeling, and saying, I'm here, I'll do whatever you need. How can I help you? And I think you may get a lot of the, oh, I'm fine, I don't need help, I'm doing great. And that may be that person's mood or the negative sense of themselves talking. So you could say, I understand that, I'm here for you, I just want you to know whenever you feel like you need something.
Okay, good feedback.
So,
good question.
So it's a hard question, right? Because everybody's going to sort of respond to that in a slightly new way. And so there's not a one-size-fits-all approach.
Okay. So here's a question from Freen. And it's about the light boxes. And are light boxes something you have to focus on while you use them, or can you have it on the background while you do something else?
Yeah, good question. I believe there's meant to be a fair amount to sort of focus on it.
So don't turn it on and then walk out of the room.
Right, exactly. You need to be in the kind of constant presence.
Okay, good question. Here's a different one from Carter. And these are great questions. We've got about 10 minutes left, so get them in now if you have one. Carter's question is there a certain age group that's particularly susceptible?
Yeah, great question. We tend to think younger folks in their 20s to sort of, mid to late 20s up until 30, but even happening younger as sort of teens as well. So we tend to see first onsets around adolescence up through, late sort of 20s or so, 30s. But again, plenty of people don't fit that mold, and it's not that information is great, but if you're 45 and been feeling this way for a few seasons, then that's what we want to help you focus on.
Got you. So here's related to that. You mentioned that often you first see it in adolescence. What are things to look out for? And this is from Maura. What are things to look out for, and what recommendations do you have for kids if you're a parent or a grandparent or teacher?
Yeah, good question. I mean, I think it's kind of a sort of similar version of what we've been talking about, of noticing there are changes in your behavior, you're not going out with friends as much. These are the things I'm noticing about you. I care about you. I sort of love you. I want to make sure that you're doing well. So I guess the sort of domains at which you may see things, you're maybe not going to have as much impact at work, because for some kids and teens may not be working, the impact may be in other areas of their lives. Sort of academic functioning, school, social functioning. But I would say that a lot of the things I've just mentioned, I think, are going to be valid. Helping kids and teens and adolescents get connected to things and people in their life that help them feel better and that give them a sense of meaning or a sense of purpose.
Okay, really good question. Thanks for asking that. I know it's definitely definitely something to think about. Here's another one from Cece, and we were talking about light boxes and exercise, and her question is, what treatment options are there for someone with SAD?
Yeah, so antidepressant medication, cognitive behavioral therapy, light boxes. There's been a little bit of work in terms of melatonin and vitamin D. I think the data is a little bit mixed on some of that stuff. Vitamin D, particularly melatonin, actually, it's kind of what's part of the problem. Your body makes too much of it, and that's part of where the SAD can come into play. So I think we've hopefully touched on that. Antidepressant medication, psychotherapy, light boxes, and just doing these kinds of pleasurable events that help you to feel better.
Okay. So we've got a question from Kevin. I believe he just joined, so he may have missed the beginning. But what are the differences between the holiday blues and more severe depression? And how should I know when to ask for help for me or a loved one?
Yeah, so holiday blues is a little bit of a catch-all term. Maybe it's more of a sub-threshold level. Seasonal affective disorder, very similar to major depressive disorder. You need 5 out of 9 symptoms most of the day, nearly every day, for at least a 2-week period, with at least one of those symptoms being low mood, sadness, or sort of lack of interest in things that you used to enjoy. What we see with seasonal affective disorder are more of those classic sort of vegetative symptoms: sleeping a lot, low energy, feeling very fatigued, increased appetite, eating a lot more as well, particularly carbohydrate craving. How do you know when you need to seek help? Again, everybody's line for that's going to be a little bit different, but I think if you're recognizing that you've been in this rut for quite some time, if it's really starting to impair your functioning across important areas of your life and important people of your life, and if you're thinking about not wanting to be here, death, dying, suicide, some of those sort of suicidal thoughts, you may naturally be more concerned about those, as will other important people in your life. And so that may be another kind of metric for that as well.
Really great questions, Kevin. Thanks for joining. Thanks for the question. Here we have one from Asia, I believe. I apologize if I mispronounced your name, but her question is, does the mood improve after the holiday season by itself?
So if you have this real seasonal affective disorder component, it likely will, because of the biochemical kinds of things we've been talking about earlier. If it's really precipitated predominantly by difficult factors in one's life or things that may be more chronic, then you probably have to get some help to make some sort of changes in that area. So I guess it depends a little bit on what it is that we're dealing with. If you're dealing with much more chronic kinds of personal life events, or if a big part of the reason why you're feeling the way you're feeling is because you're out of a job, well, we probably need to help you make some progress in that area. And when March rolls around, it's not magically like everything's going to suddenly be right. So it depends a little bit about what the cause is.
Okay.
Yeah.
Great question. Thanks for joining. Thanks for the question. I know we've been sharing a lot of resources that NAMI Dallas offers here in our comments. What do we have here at UT Southwestern?
Yeah, great question. So our group has a number of longitudinal research projects. One of them is called D2K, Dallas 2000, because we want to enroll 2,000 participants with current or a prior history of a mood disorder. And here we're looking for folks 10 and up. So children, adolescents, young adults, middle-aged folks, all up the scale. And then we have a companion project aimed only at folks 10 to 24. So children, adolescents, young adults who have no current or prior history of a mood disorder. And we're following both of those groups 4 times per year for up to 10 years, and doing a lot of self-report instruments and blood and neuroimaging and EEG and a number of other kinds of cognitive tasks. You also get what we'd like to call a mental health checkup, in terms of you're meeting every 3 to 6 months with somebody asking you a lot of questions to gauge how your mood is, how you're doing. And so in that way, we can provide feedback about how you're doing at a 3 to 6 month interval, as well as help folks get in touch with various resources.
Okay.
I think for many of our participants, they say, boy, this research is really helpful. It really helps me feel like I'm giving back. I'm building a legacy or helping other people who have faced a lot of the same concerns as I have. So I think that's a big research-related resource, and certainly there's many research opportunities beyond that I've mentioned inside our group and outside of our group. We have a wonderful outpatient psychotherapy and psychiatry clinic here, and medication, counseling, resources, referrals, and certainly many support groups inside and outside of our group. NAMI has 3 wonderful resources: family support group, peer sort of a peer-to-peer support group. There's a lot of psychoeducation that happens in those groups as well. NAMI also does a lot of very brief sort of handouts and YouTube videos, things like that. So if you're interested in getting yourself or your friends or family connected, NAMI is a wonderful outpatient resource with a lot of wonderful sort of support and psychoeducational based groups.
Great, good to know. And we're going to share a lot of those resources here, as well as a link to the CDRC for those of you that are interested in participating in some of the clinical trials we have going on here at UT Southwestern. We're down to 5 minutes or less, so if you have a question, now's the time to get it in. We did get one in, and the question is, are there any, and this is back to Lightbox, which is very interesting, are there any drawbacks to light therapy that somebody should consider before going out and buying a Lightbox?
Yeah, I don't know. I mean, there's a cost to it, obviously. You may not feel like you're able to sort of sustain or to maintain that, but I haven't particularly been aware of any major, pardon the pun, black box warnings or any sort of issues with that I know about. I'll do a little bit more research into that, and if I hear of any, we'll figure out a way to let folks know. But, you know, this is one possibility, but not the only possibility in terms of treatment.
Okay. So, yes, we definitely talked about 3 or 4 different treatment options during the chat.
And it's not necessarily you could just do one of those, right? I mean, sort of combination may be helpful too.
That sounds really good. So as we're wrapping up, I mean, given, you know, we've spent the 30 minutes talking about holiday blues and seasonal affective disorder, as we're really entering into the holiday season, what kind of message do you have for people that are watching that maybe they're not ready to call? They don't want to schedule an appointment, maybe they're trying to figure out how to best start.
Yeah, I think I would first say I'm sorry that you're feeling the way that you're feeling, and I and certainly other people around you hope that we'll be able to figure out something that helps you to feel better. Also, I think to know that you're not the only person feeling this way. We've talked about, maybe we didn't talk about, but we should, you know, 5% of folks each year tend to have SAD, and MDD, this sort of incidence rates tend to be even higher. So you're not the only one feeling the way that it is that you're feeling. You know, understand that, you know, it's not just you, and figure out what it is you want to commit to doing something even slightly sort of differently over the next day or week or month. Is there a good friend you haven't reached out to in a while you'd love to give a call to or write them a note? How can we, you know, figure out how do you build in some of these small day-to-day kinds of things in your life that get you connected with things and people and places that help you feel a little bit better and that increase your mood? And what can you ask for help on? I think we didn't talk much about this, but holidays can be really sort of stressful for many people, whether you have lots of kids or no kids or lots of family or no family, and you may need to ask for help. So I always use, you know, every time you fly, the safety video always says, put the oxygen mask on yourself first before helping anyone else. And so don't be afraid to ask for help. Hey, honey, I need some alone time right now. I need to take a nice hot bath. Can you pick the kids up after school? So don't, in small ways or even larger ways, don't be afraid to ask for help.
Okay, great. And with that, you mentioned, you know, reaching out to friends. Do you recommend in person, or, you know, what if they reach out through Facebook?
Yeah, you know, I think, again, it really depends. You're going to know how your friend is most likely to sort of respond if they get that message. No, not nobody, but we don't call people on the phone as much anymore as we text or Facebook Messenger or other kinds of forms, and there's probably many forms out there that I don't even always know about. So only you know how that particular person is going to respond. You know the kinds of people who are going to respond well to texting, to calls, to in person, to writing a note or whatever. So whatever works for that person is going to be what you should probably do.
Okay, that is a perfect way to end our chat.
Okay.
We are all out of time. I want to definitely thank everybody for joining, for all the great questions, for NAMI, for your partnership. Really appreciate it. We will be sharing this. It'll be here on Facebook, and it'll also be on our YouTube channel later this afternoon for individuals that don't have a Facebook account. Mainly, though, I want to thank you, Dr. Trombello, for joining us. I think it's been a great chat, and I hope you have a wonderful holiday season.
Thank you.